Now look at the theories of psychosomatic illnesses. So when you're dealing with psychosomatic illnesses, psycho, you are in relation to, or you're relating something to the mind or something that concerns the soul. Then somatic, something that deals with the body. So somatic is just body. So theories of psychosomatic illnesses, you are dealing with those disorders or diseases that are able to affect both your mind and also the body. Right. So these are our key objectives. We'll first try to understand the theories of psychosomatic illnesses. We'll describe the biopsychosocial model and also understand the biomedical model. We'll also describe the psychodynamic model, and we'll try to identify the behavioral and cognitive model. Then last but not the least, we'll understand the health brief model. Alright, so as I alluded earlier, theories of psychosomatic disorders, they're just a group of disorders characterized by physical symptoms that cannot be fully explained by neurological or organic conditions. And it is a term that has been known for more than 50 years, this term psychosomatic, in the field of psychiatry. So, as I said earlier, psychosomatic, you are dealing with the mind and body connection. Alright, let's now look at the causes of psychosomatic illnesses. So, the causes are known. Number one, psychosocial theory. So, you're dealing with symptoms of social communications as to express emotions or symbolize your feelings. Then, when you're dealing with the psychoanalytic interpretations, you are just considering the symptoms that are portrayed as instinctual impulses, psychoanalytic. So you're just trying to deal with these symptoms that are expressed as instinctual impulses. Then biological studies, it is where individuals may have a thought, perception, or just the assessment about the sensory inputs. So these are how these causes are known: psychosocial theory, psychoanalytic interpretation, and also through biological studies. Alright, so we can also go further to look at the genetic data. So somatoform tend to run in families with the occurrence of 10 to 20 in first degree, that is female relatives. Then we can also look at the anxiety and depression, which are common in families of somatizing children. Right, so when you're dealing with the psychosomatic illnesses, this was first understood as a disorder, as just dealing with your head, only in your head, and that was in the period of 1980. So psychosomatic was just a diagnosis of a terminology in DSM. Okay, so psychosomatic has somatic symptoms, just like the word itself, somatic, meaning it has body symptoms. The use of the term psychosomatic is just for organization. Right, so when you're dealing with these psychosomatic disorders, which are abbreviated as DSM-2, so these are skin disorders. They are disorders that affect your skin or your just your physical body, which is the external part of your physical body, or those disorders that affect your musculoskeletal system, those disorders that affect your respiratory system, the cardiovascular system, the genitourinary system, the endocrine system, the disorders that affect special senses, and also just other type of disorders. So psychosomatic medicine is just a mixture of psychology, sociology, and physical explanations of illness, which are addressed as psychophysiological. Then, in psychosomatic medicine, we need to understand that conflicts produce anxiety, which become unconscious, and also this takes a physiological state on the body through the autonomic nervous system. So psychosomatic medicine is just a mixture of psychology, sociology, and physiology. Somatic, so physiology, psychology from the word psycho. Then they are just explanations of the illness which are addressed, such as, or known rather, as psychophysiological. Then we said they conflict to produce anxiety and become which then become unconscious, and they takes physiological state on the body through the nervous system. Right, so one thing we need to know is that psychosomatic medicine is subspecialist in psychiatry, okay, as a concerned region, as it focuses on the care of medically ill patient. So it is not really the actual medicine, but we are trying to offer something that is going to help the patient heal, even as they are taking that same medication. So we are saying that this psychosomatic medicine, it is just there to focus on the care of the medically ill patient. Then we have what is known as DSM, which is a diagnostic statistical menu, DSM-4, and this is just a scale of an example which state the psychological factors that are able to affect the physical state of a particular person. Alright, then when you're talking about the Biopsychosocial Model, this was proposed by, or founded rather, by George Engel, and it was in the year 1977. So its basis was just on the biological, physiological, psychological, and the social sciences, as the word itself, biopsychosocial. So bio, you're doing biological, psychological, and social sciences. Okay, so this theory, it is very important so that you can understand the mental disorders and the emotions which patients are able to experience. So it is there so that you can understand the beginning of a certain disease, which is usually due to certain factors that affect the body, or that affect the normal functioning or physiology of the body. And bio is just a contributing factor, which can include genetic viruses, bacteria, and also some structural defect. Psycho, we are dealing with the healthy and the illness, and this is in terms of cognitions, which is the way a person is able to think. That is expectation, e.g., expectation of health, and also emotions, something to do with fear or any feelings. So that is emotion cycle. It is focusing on the emotions and also the behavior. I can give an example of how a person is able to feed themselves, the exercises, what they do, if they smoke, they take beer, and all that. Then social aspect, you are dealing with the aspects of health, where they are described in terms of social norms of the behavior. So this could be how the person is able to handle or carry themselves socially, how they relate with other people, and what they do. So We can look at the pressures to change in behavior that is expected from peers or maybe the group where they are found, and also the parental pressure. So that is in relation to social, the pressure, the social values on health that are imposed from parents. Okay, and this could also be the social class and also the ethnicity to which tribe that particular person belong to. So this is just a diagram depicting the biopsychosocial model of health. As we said, it has to do with the biological, which is genetic vulnerabilities, disabilities, physical health, and also the social, to do with the peers, family circumstances, school, esteem, to do with the psychological coping skills, social skills. And we'll find that between social and psychological, you might find something to do with family relationships, because these affect both your psychological, the way you are thinking, and also the social aspect of you. And this can also be trauma, which affects both the social, your mind, and also your social relations. And between the social and the biological, we'll find that we can talk about drugs. Drugs are able to impose a negative effect on your body, and it is also as a result of your social relations with other people. And also on the biological and psychological, we can talk about IQ. So the IQ, the intelligence quotient, would be determined genetically by your patient, that is biological. So IQ, you're trying to talk about how your mind, how you're able to think, your cognitive, that is also psychological. So these act as an intersection. Then the biological aspect, the social aspect, and the psychological aspect will be there to influence your mental health. So it is very important for us to understand that. And this model is commonly used in chronic pain, the pain that still persists or the pain that lasts for a long time. So that is one thing we need to understand. And it views the pain in a psychophysiological behavioral pattern that can be categorized in those three ways. So the pain can be described in those three ways: biological, being biological, psychological, and also social. So this person, Angel, he stated that to provide a basis for understanding the determinant of diseases and arriving at a rational treatment pattern, or giving a good care to a certain patient, it was important for us to take account of, one, the kind of patient we have, and also the social context in which they were living, to consider whether this person was involved in drinking, smoking, and that will tell us, or it will be there to help us find a proper treatment pattern. Then also the complement system, which is advised by the society rather, where they were living, and also the disruptive effect of a certain illness. So this can help us understand and provide the cause of of the certain disease, and also arrive at a proper and rational treatment. So when you're dealing with the biomedical model, you're just trying to focus on how you deal with a certain kind of disease using biomedical approach. So biomedical approach is developed at a time when psychiatric facilities were negatively viewed by society due to strict and traumatic treatment method, e.g., drilling into one's head. So this was the time when the society perceived the psychiatric facilities to be a bad way in which they were handling this kind of patient. So they came up with this biomedical approach, so which now was there and was there now to help these patients suffering from these different kind of psychosomatic disorders, so that they are helped and also they are treated in a good way. So the biomedical model of illness or health has been at the forefront of Western medicine since the end of the 18th century. So you must take note of that. It was since the end of 18th century and grows stronger with the progress of the modern science. So in understanding the technical basis of this medicine, the science of autopsy was developed. I'm sure we understand the term autopsy. So autopsy was now allowed by medical practitioners to see the organs that were implicated in different diseases. So autopsy is just a surgical method where they try to check or to remove a certain tissue from a certain organ in order for them to attempt to find the cause of the death of that particular person. So they try to maybe do a surgical method. They try to do a surgery. It could be maybe the brain, so that they can see, or the heart, or the liver. Then they get a particular issue. Then they try to see the cause of that particular illness. All right. So it emphasizes on all diseases, or rather it emphasizes that all diseases are explainable through some sort of cellular abnormality. Now, when you want to understand the biomedical model, we need to understand that bio means something which is just genetic, and it consists of the viruses, bacteria, and lesions. Then this biomedical approach, it focuses on the organic and cellular pathogens as the basis for diagnosis and also treatment recommendation. E.g., or for example rather, pathogens which are able to affect the biochemistry and the physiology of your body. So understanding how those pathogens were able to cause these diseases was an important aspect when dealing with the biomedical model. So you need also to take into account that this one does not focus on the social factors or individual subjectiveness. Okay, so understanding this biomedical model is very important, so as to reduce the illness and also low level processes such as disordered cells and also at the chemical imbalances. So one thing we need also to take note is that it fails to recognize the social and psychological processes as powerful influences over body estates and assumes a mind-body dualism, like the way the mind is able to correlate with your body. So it is able to recognize those processes as powerful influences. So it emphasizes the the illness over health, rather than just focusing on the behavior that promotes the health. So this biomedical approach, one thing we need to understand is that it cannot address many puzzles that face practitioners. For example, if 6 people are exposed to a flu virus, do only 3 develop flu? So let's say an example whereby there are these people who have come, they are 10 or they are 6 rather, and they have been exposed to a certain virus. So is it that 3 of them will have flu, or is it that the other 3 will not have flu? So that is this biomedical approach cannot address. So the biomedical approach also looks at how the treatment can be done and also the medical interventions that are necessary so that the body can be restored to normal. Okay, so this means that the biomedical approach only deal with illnesses after a person has got it, not before a person gets that kind of illness. So we need also to take note of that. So when you're dealing with mental health therapy, we are just trying to look at the ways in which we can keep our mental being in a good condition. So one thing we need to understand is that diseases either come from outside the body, then they invade, or they can be triggered just inside our body, or originate as internal physical changes. So individuals are not responsible for these biological changes which are beyond their control. So one thing also you need to understand is that it is an individual who is a victim of some external force. So there's this external force which can cause an internal change of the body. For example, if a person has been involved in a certain accident, so that is an external force and it can affect the physiology of the body or a certain part which is internally in the body. Okay, so this biomedical approach, it is there to consider the aspect of the mind and the body and how each and every or both the mind, or rather should I say how the mind and the body is able to function independently, and it is comparable to the traditional dualistic model of the mind body split. Okay, so one thing we need also to take note is that it is incapable of the influence of physical matters and the mind and the body as defined as separate entities. So the mind is seen as an abstract because we cannot see it, and it is relating to the health. Okay, so the feelings, the thoughts, and the body is seen in terms of physical matters such as the skin, the muscles, the bones, the brain, and other body organs. So changes in these physical parts or physical organs are regarded to be independent of the changes which happen in the mind. Now, one thing we need to ask ourselves is what is the role of these psychology rather in health and in illness. So in traditional biomedicine, illnesses may have some psychological consequences, and these illnesses maybe they cannot be caused due to psychological means. So for example, cancer can cause someone to be stressed, depressed, unhappy, but it is no way either related to psychology. It is not caused by psychological means. So that is one thing we need to understand. Then when you're talking about psychodynamic model, you're just trying to consider how how these are related to the classical psychoanalysis of a certain disease. So it becomes more powerful and useful for us to understand the human behavior and also try to explain the mental and also emotional beings of the childhood, and also how the behavior is going to affect this particular person. So the continuity of the personality from childhood to the time when this child is growing, there are certain roles which a child experiences, or rather they are the roles of the childhood experience that lies in the heart of the psychodynamic approach. So the study of this unconscious is part of the psychodynamic model, and many of the models in Nancy began in Australia. So that was according to the physician Sigmund Freud in 1856 to 1939. Okay, so according to Freud's psychodynamic model, in the human mind conceptualized is in terms of two aspects. So according to this Freud psychodynamic model, it focuses on two aspects: the conscious mental processes, which are the awareness of your mental events, the thoughts, the feelings, and also the ability for you to remember something. Then the unconscious mental aspect or processes, which are just your thoughts and the feelings that are outside awareness and not remembered. So conscious, they are aware of these mental events, and also you can remember them. But unconscious, you're dealing with the mental processes and thoughts and feelings that are outside the awareness of your body. So this is where we end with part 2. Stay tuned as we continue with part 2. So this is part 1. We end here. Let's continue with part 2. See you in the next one.